I know John Cargo, and I had given him a loan of 60 million.
There have been transactions involving Ben Geddy and Josephine Kafura with Senator Kipchumba Murkomen and with Farouk Kibet.
When we know that theft of public funds has happened, as it did in the NYS presided over by Waiguru,
it was very difficult to detect what was going on, particularly on this case where officers are short-circuiting the system.
Tuliongea mambo NYS, akasema tumesema uongo. Imekuja ikadhihirika.
Hatujamaliza sakata ya NYS, sasa mambo ya hospitali imeanza.
This audit was initiated from my office with good intention.
People who are guilty of corruption need to go to prison.
Hello there, just in time for NTV at 1. I'm Trevor Mbija. Now, here's the latest. Kenya National Union of Nurses officials are currently in a meeting with officials from government at Afya House to find a way forward that's to end the medical practitioners' strike. The meeting, which began at 11 a.m., is meant to facilitate a solution, that is to get a solution towards the strike that is getting out of hand and becoming worse by the day. Now, I want to join Leila Mohammed, who's standing by there to find out the latest. Leila, what's happening right now?
Well, it is expected that at the end of the day today, there will be some form of smoke at the Afya House, depending on the color, black or white, whether the Kenya National Union of Nurses will agree to a remuneration package that will be tabled today as part of the negotiations between the Nurses Union and officials from government. It is expected that at the end of today we shall be able to know whether the nurses will continue to join doctors in the ongoing strike, or they will say that they're going back to work. As we speak, Trevor, the Kenya National Board, Medical Practitioners and Dentists Board of Kenya has released a statement warning any medical practitioner going against what it calls contravening the law by their yesterday's threat of stopping functions at all private facilities and private killings and private clinics and mission hospitals across the country. They say that according to the law that we passed in 2010, every Kenyan or every citizen, every resident living in the country has the right to access of medical care at any private facility or government facility for that matter, and making them not to access this kind of help is going against the Medical Practitioners Board and the Constitution. The KMPDU, we spoke to them earlier today, and they say a meeting that was scheduled between them and the government was stopped indefinitely. Those talks I hear have not gone as far as they were 3 days ago, and the doctors are remaining adamant that they should get the 300% pay package or nothing else. On Tuesday, it is expected that medical practitioners who are in the private medicine will be able to join their counterparts in the public sector in downing their tools. The government saying probably they should reconsider this and consider the patients in the country. We have seen cases of persons dying or others seeking help from other private facilities because of the current crisis. It is day 5, Trevor, and counting. We hope that at the end of the day today, we shall be able to see some form of white smoke. The Nurses Union yesterday saying that yesterday they had a 10-hour meeting between them and officials from the Labour Ministry, the Ministry of Health, the Council of Governors was also here, the Treasury was represented here, and the meeting was scheduled to begin today at 11 a.m. The chairman and the secretary general, along with other officials, walked into the Afya House. The meeting is still ongoing. We are still out here waiting to hear what the parties will have agreed upon at the end of the day. There are various parties who are speaking about the issue. The Council of Governors, the evangelicals are expected to speak at 3 p.m. to speak on what the government should do, Trevor, to end the current crisis in the health sector.
It's Leila. That's Leila Mohammed speaking to us live from Afya House, where a meeting is going on between the Kenya National Union of Nurses officials and the government that started at around 11 a.m. As she says, there's going to be some sort of indication whether they're going to go back to work or not. But KMPDU is still maintaining that they shouldn't. So we will let you know how that pans out. In the meantime, President Uhuru Kenyatta says he's hopeful that doctors will reach an agreement with striking medics by the end of the day. Speaking in Kericho, the president says he has been following negotiations between the government team and medics and thinks a solution will be realized. That coming up in just a bit, and of course we'll also be going back to Afya House to find out what exactly has happened. But this strike by doctors and nurses entered the 5th day today, with the situation getting worse in public hospitals after the government failed to strike a deal with the doctors union. One person died at Kitui General Hospital as there was no doctor or nurse to treat her.
The strike by medics countrywide continue to cause pain, death and suffering. Public hospitals have paralyzed operations across the country, leaving many ailing Kenyans unattended to. A female patient was admitted at Kitui General Hospital died as medics kept off their workstations. A casual worker at the hospital who spoke to journalists said the woman's situation worsened at around midnight, but no doctor or nurse was present to save her life. She died as her relatives watched helplessly. The fate of some 22 babies born prematurely hangs in the balance due to lack of specialized neonatal care. The babies who are being housed in incubators were abandoned and left under the care of subordinate staff who know little about monitoring their progress. The major county referral hospital was mostly deserted and quiet, with about 6 patients whose fractured limbs have been put under traction remaining in the male and female wards. The patients have been left under care of clinical officers, security guards and cleaners besides their relatives. Other patients have since vacated the facility to seek treatment elsewhere, mainly from private hospitals. Meanwhile, health services at various sub-county hospitals in Nakuru County have resumed following the hiring of more than 200 health workers on temporary basis. The sub-county hospitals that have resumed were Karungai Health Center, Langalanga Sub-County Hospital and Subukia Sub-County Hospital. Patients started flocking the facilities as early as 7 a.m. Clinical officers, pharmaceutical technologists and lab technicians have been posted in the health facilities.
The biggest challenge we had before for this specific facility is that we didn't have a clinician to run the outpatient and nurses to run the outpatient. But now with the additional nurses, we are now able to start offering services. So mine is to ask wananchi, wakuje, wapoe services, because now we have no reason as to why they should not be attended. We want to start offering maternity services. And we'll also be offering cesarean section, CS.
Security has also been beefed up in the facilities, with each manned by 2 armed police officers. The county government intends to open 15 health facilities.
So like I mentioned earlier, President Uhuru Kenyatta says he's hopeful that doctors will reach an agreement with striking medics by the end of the day. Speaking in Kericho, the president says he has been following negotiations between the government team and medics and thinks a solution will be realized.
I solidly believe that because we have been following the negotiations, the discussions, I'm hopeful that by the end of the day, we should reach, an agreement, But what is most important, is that we need to work together in a spirit of understanding, because we don't want our patients to suffer, right? We don't want, Kenyans, innocent Kenyans, to suffer. And as we continue with this dialogue, I take this opportunity to thank you, because there are many like you also around the country who are recognizing that as much as there's an issue, they still have a responsibility to look after their fellow citizen. And I thank you very much for that. And mine is to promise that the discussions which have been going on in a lot of detail for the last, including at night, we are very hopeful that we will get to some compromise, some understanding that takes care of your welfare, that recognizes the important role doctors and nurses play in our country. And that is why we're here, in terms of giving this extra equipment, supporting the county governments in various areas, because we want to improve our ability to give health care to our Kenyans. That is what we want to do. And we can't do that without you. Equipment without people like you to manage is useless. We need you. We just want your understanding. Okay? Yes. We move together as a team. Yes. Asante.
And beyond the borders, the East African Community-led facilitation delegation to Burundi has defended the legitimacy of President Pierre Nkurunziza's government amid claims of denouncing it before holding talks. In a press conference after a 3-day visit to Bujumbura, where he held several meetings, former Tanzanian President Benjamin Mkapa, who's the lead facilitator for the Burundi talks, said the government was in place out of the will of the people of Burundi. Opposition leaders outside the country have been reluctant to participate in talks, insisting that Nkurunziza's government was illegitimate. They have also refused to come back to the country for fear of political torture and assassinations.
And they all said this is a legitimate process which has come to a legitimate conclusion. So those who think I'm the one that is rendering legitimacy are absolutely out of their minds. Quote me, they are absolutely out of their minds. Ambassadors come here, they present credentials to President Nkurunziza. The Security Council resolutions recognize him as the president of this country. So what is this foolishness? We are spending a lot of time talking about an event that is all over. That is why the communique says we should emphasize on creating conditions that will make such confusion obsolete come 2020. That will produce conditions of an election in 2020 which will be free, fair, and credible. If there are any complaints, this is the time to get together and sort them out. That's all I'm saying.
Well, back home, 80% of radio journalists in Kenya are not professionally trained. This is according to the Media Council of Kenya. The council CEO, Haron Mwangi, disclosed that out of the 156 radio stations operating in the country today, only 20% had employed qualified presenters and reporters.
Mwangi was speaking at a county stakeholders consultative forum for peace in Kisumu. He said that nearly all the vernacular radio stations had contracted people without any journalistic background to run the FM stations, hence giving the profession a bad image.
And most of them are manned by young people, 18 years old, 20 years old, 22 years old, with no any other knowledge apart from the power and ability to speak smoothly and convincingly with this mic. Nothing else.
Mwangi warned that this was dicey, especially now that the country is entering the electioneering period.
Initially, the Media Council did not have a complaints commission because we had a case with the government in court. Now we have a complaints commission. This complaints commission is where you bring all sorts of complaints against the media. Now, as we speak, I have complaints from the Deputy President. We have the complaints from the Minister of Information. We have complaints from the Minister of, from the Treasury. We have complaints from the Minister of Interior. And we have a very powerful commission that is listening or hearing these cases or these complaints.
The Media Council CEO said that most of the vernacular FM stations were owned by politicians who use them to disseminate misleading and sometimes inciting messages. During the meeting, which was organized by Local Capacities for Peace International, the National Cohesion and Integration Commission revealed plans to post 94 cohesion monitors to all the 47 counties ahead of next year's polls.
So the social media is a challenge, and of course Dr. Mwangi mentioned that media should not cover fellows who are wrestling down, who are fighting. But what happens with that ordinary Kenyan with a mobile telephone gadget? They record, and in no moment the whole country will be circulating that clip.
Oukokusa, NTV.
While staying in the counties, hundreds of residents from Makima Ward, that's in Embu County, took to the streets to protest against what they termed as unfair allocation of the controversial Mwea settlement scheme to non-locals.
Chanting slogans, waving placards and twigs, the angry protesters marched to the streets in Makima Ward, Embu County. The protesters claimed that strangers from other parts of the county had been allocated huge chunks of land at the Mwea settlement scheme, leaving locals who had lived in the region for more than 5 years homeless. They alleged that out of over 25,000 families, only 441 households had been allocated land after the subdivision exercise, which lacked public participation as required by law.
Buzetu wamezaliwa hapa, wamesikwa hapa. Sisi ni watu wa amani. Tumeishi watu wa kabila mbalimbali. Hii ni Amerika ingine. Kuna kabila zote za Kenya hapa Makema. Sisi hatuna umbaya na mtu yeyote. Tumevumilia, tukavumilia, haki itendeke, hatuoni haki. Sisi tutaenda wapi? Tuna watoto, hata tangu tuanze kupigiwa kelele tutaondolewa huko, wengine hata hawakulala nyumbani. Sasa hata tujui tutafanya nini.
The scheme was recently converted to private land to give residents who are formerly landless a chance to legally own the parcels they occupy. The protesters claim that the allocation process was marred by bribery and political interference.
Sisi wenyeji kwanza tupewe haki yetu, tupewe, atukatazi shamba ikigawa. Na sisi tuna imani ya kwamba hatuumizi kitu wa mtu, lakini haki yetu itimishwe, ikitimizwa tutakuwa haki.
Anti-riot police officers lobbed tear gas canisters at the protesters who had barricaded all roads leading to Makema. The residents are now calling on the government to cancel all title deeds issued and start the allocation process afresh. They also want the National Land Commission to arbitrate over the matter before the contentions get out of hand.